Today we are discussing about Kerala PSC Staff Nurse Grade 2 Previous Question Paper Part 3. Question number 1. A patient who is taking beta blockers is monitored for shock. What present to such patient? Options are hypotension, tachycardia, oliguria, altered mental status. And the answer is tachycardia. Question. Which of the following statement is correct about malignant tumor? Options are malignant tumor stop dividing prematurely, malignant tumor invades surrounding cells and tissues, malignant tumor remains localized, malignant tumors have defective cell communication. And the answer is malignant tumor invalids surrounding cells and tissues. Next question. The cost-effective way to prevent spreading of microganism is. Options are wearing mask, wearing gloves, hand hygiene, wearing gown. And the answer is hand hygiene. Next question. Ponderal index of the gestational age normal neonate is. Option A greater than 2.5, option B less than 2.5, option C less than 2, option D 2. And the answer is greater than 2.5. Here note the point. The copulence index or ponderal index is a measure of leanness or corpulence of a person calculated as a relationship between mass and height. Next question. The immediate action taken by a first aider to risk a victim of heat stroke. Options are give oral fluids. Option B fanning of victim. Option C remove victim from hot environment. Option D spraying water over the victim. And the answer is remove victim from hot environment. Which of the following is not a cause for pernicious anemia? Option A bleeding, option B chronic alcoholism, option C long-term use of certain antibiotics, option D lack of intrinsic factor. And the answer is bleeding. Next question. Which of the following surgery leads to dumping syndrome? Options are appendectomy, gastrectomy, cholecystectomy, sigmoidectomy. And the answer is gastrectomy. Next question. Which of the lab value would the nurse to be evaluated for a patient with pancreatitis? Options are serum lipase, serum CPK, serum ALP, serum AST. And the answer is serum lipase. Next question. The extrapyramidal side effects of antipsychotic agents are managed with the following group of drugs except. Options are dopamine drugs, anticholinergic, antihistamines, barbiturates. And the answer is barbiturates. Next question. Among the following, which one is a delusional disorder? Option A, trains. Option B, Capra syndrome. Option C, dissociative fugue. Option D, Ganser syndrome. And the answer is Capra syndrome. Next question. Which one is a fact about persons with a suicidal tendency? Option A, suicidal happens without warning. Option B, once a person is suicidal, he or she is suicidal forever. Option C. Most suicidal persons are undecided about dying or living. Option D. Suicidal persons are fully intent on dying. And the answer is most suicidal persons are undecided about dying or living. Next question. Publication of a false statement about an individual made verbally or in some other form to the third person. Option A. Battery. Option B. Displacement. Option C. Depersonalization. Option D. Defamation. And the answer is defamation. Next question. Most frequent neurotic disorder in puerperium. Option A. Postpartum blues. Option B. Postpartum depression. Option C. Postpartum psychosis. Option D. Delivery-related stress and anxiety. And the answer is delivery-related stress and anxiety. Next question. Which of the following is used in drug dependence to prevent relapse? Option A. Naloxone. Option B. Naltrexone. Option C. Neuroleptic. Option D. Nomifensin. And the answer is naltrexone. Next question. The most commonest psychiatric disorder after head injury is option A. Mania. Option B. Schizophrenia. Option C. Depression. Option D. Phobia. And the answer is depression. Next question. Which of the following is not an element of management? Option A. Reporting. Option B. Organizing. Option C. Staffing. Option D. Commanding. And the answer is commanding. Ability of an instrument to detect changes or differences when they occur. Option A. Validity. Option B. Reliability. Option C. Objectivity. Option D. Sensitivity. And the answer is sensitivity. Next question. Which among the following is not a fact about EBP? EBP means evidence-based practice. Option A. It is used of best evidence to make decisions about care and treatment. Option B. Contribute to expand the knowledge base of profession. Option C. Includes patient preferences and values. Option D is another term for utilization of research findings. And the answer is it is another term for utilization of research findings. Next question. As per the triage system, green color code refers to option A. Injuries are life-threatening but survivable with minimal intervention. Option B. Injuries are minor and treatment can be delayed for hours to days. Option C. Injuries are extensive and chances of survival are unlikely even with care. Injuries are significant and require medical care but can wait for hours without threat to life. And the answer is injuries are minor and treatment can be delayed for hours to days. The audit which is conducted between two regular audits. Option A. Interval audit. Option B. Final audit. Option C. Intra-audit. Option D. Continuous audit. And the answer is interim audit. Next, one nurse is assigned the responsibility for the case of each patient from admission to discharge. Option A. Case method. Option B. Primary method. Option C. Functional method. Option D. Team method. And the answer is primary nursing. Informal communication is also known as option A. Diagonal communication, option B. Crosswise communication, option C. Grapevine communication, option D. Horizontal communication. And the answer is grapevine communication. Truth-telling about disease and its prognosis to terminally ill patients. Such a situation which ethical principle is followed by a nurse. Option A. Confidentiality. Option B. Fidelity. Option C. Justice. Option D. Veracity. And the answer is veracity. Next question. Name the program launched by the Department of Women and Child Development (MHRD) in 1998 to boost up women's health, education and political participation. Option A. National Policy for Empowerment of Women. Option B. National Perspective Plan for Women. Option C. Swashakti. Option D. Swayam Siddha. And the answer is National Perspective Plan for Women. Next question. Which compound is known as inorganic benzene? Option A. Borax. Option B. Diborane. Option C. Borazine. Option D. Boric acid. And the answer is borazine. Thank you.